Hi everybody, it's Jennifer McCreath again, balancing my camera. It's Friday, November 8th. It's not balanced. Oh my goodness, it's been a long day. I pulled an all-nighter last night at work, and I spent all day doing media. Two major news stories here locally in St. John's in the province of Newfoundland. Provincial Government, Department of Justice Minister announcing he's adding gender identity, gender expression to the Human Rights Act, finally. And transgender man by the name of McCreath all over the news, raising awareness and concern over issues I've raised in the past. The fact that our provincial government's healthcare system is not adequate in terms of providing timely and affordable access to products and services that we need. I guess we'll start with human rights. I mean, something's been going on a long time in every province and federally. We're looking at bills. We're looking at wording. It's exciting to see gender identity and gender expression added to the Newfoundland Code. It's well known that at the federal level they've debated whether or not to include gender expression, and I've made it quite clear that I feel that discrimination against someone's gender expression is 100 times more likely than discrimination because of somebody's identity. Expression is what you see, my outward-facing appearance, the way I act, the way I talk, things I say, things I put on YouTube. My identity is, it's up in here. Nobody really knows how I identify unless I tell people, and again, that's through expression. Seems to be a lot of people out there celebrating. Don't want to have to name names, but I will, because Jerry Rogers been in the news a lot talking about this. Federal provincial member of the NDP, the justice critic, celebrating. I'm not quite ready to celebrate. It's been a long, hard 7 years of transition being Jennifer in Newfoundland. I don't have to go on and on about my story. We all know that. I've lost my job. I've been refused to be hired into other jobs even though I've won job competitions. I've had the healthcare system refuse to provide products and service and funding. I've had to dig deep into my line of credit to cover healthcare costs. I've been refused access to accommodation, denied housing, been ostracized, been ridiculed. I've had people unfriend me. Putting words in an act is nice, though. It's a step in the right direction. At least now there's recognition that gender expression is not the same as sexual orientation. We can now finally start tracking instances of discrimination in terms of discrimination cases, discrimination complaints. Still, it's time for the rest of the government and the rest of the world to catch up. We got policies that are inadequate. The healthcare. Poor Christopher Higdon. Trans men need top surgery, perhaps even more so than bottom surgery. MCP here, medical care plan only covers bottom surgery. So doctors, worldly renowned, recognized doctors have come together with assessment protocol and recommendations on how to treat gender dysphoria, and that includes in some cases top surgery. And the doctors here in Newfoundland do a great job with the assessment of trans people. Chris has great doctors. I've got great doctors. One, they want to send people to Toronto for further assessments at a clinic, controversial clinic known as CAMH. Totally unnecessary. And then, by the way, ask the trans people to physically pay for transportation to and from Toronto up to a dozen times. So yeah, and I raised this. I went to the Human Rights Commission. I mean, that's another part. The human rights process is flawed. You can put what you want onto the grounds, but there's significant limitations in our Newfoundland human rights procedure compared to other jurisdictions. Perhaps the biggest issue is the lack of ability to undertake investigations on systemic discrimination. It has to be individual discrimination. I filed a complaint that the healthcare system was discriminating against me as a trans person, making me jump through additional hoops to get access to the same types of healthcare products and services otherwise made available to everyone else. They came back and said, you're not facing individual discrimination. All trans people perhaps are facing discrimination. As long as they discriminate against all trans people equally, there's nothing we can do. That's essentially what I took away from that. It's not a human rights act. It's not within our scope of work. You need to go fight the health policy writers. No, not good enough. If there's a policy issue, Human Rights Commission's been asked to investigate. They should have authority to proceed, to at least have an investigation. They do that at the federal level. This clearly is an issue. The media, thank you, CBC, for taking on this particular story. I've written the Minister of Health. Jerry Rogers has been communicating with the Minister of Health. A lot of people have been in touch and dealing with this. Doctors are putting their foot forward too, saying we want to be able to help our patients. We're capable and competent of helping our patients. Give us the tools and the authority to do so. Now CBC is pushing them, and government, you're going to look like a fool if you don't upgrade this policy and procedure soon. The hiring process, let's talk about that a little bit. Human rights. Jennifer McCreath has won 2 job competitions with the government of Newfoundland and Labrador in the past year. However, was not hired. They offered the job, not to me. They wouldn't give me an explanation. And guess what? They have a privacy act that says they don't have to tell me. This leads me to believe that I faced discrimination. The reason I was not hired into those 2 specific jobs was because of discrimination. Further evidence that there's more work that needs to be done. I lost a great job. I'm out probably $500,000. If I would have stayed in the job I had at the time I came out as Jennifer and lost that job, I would have been paid $500,000 more in salary than the amount of money I've been able to make since then. After I lost that job, you know the story. Unable to find work, even half that level. I've been earning half the amount of money. Yet my healthcare bills have skyrocketed, so thank you credit card, thank you personal line of credit. It's unfortunate. I have to spend time and money fighting. I'd love to go back to school and get myself a master's degree. There's money I don't have. I'd love to have better. The list goes on. I mean, most trans, and I'm, amazingly enough, considered in the top 10 percentile. Trans people are so grossly underemployed that most of us live in poverty. Most of us are living on the streets, are homeless. And when you're dealing with that, it opens the doors for mental, depression. And that's why you see suicides happening. You know? It's totally not necessary. It's absolutely ridiculous. I'll celebrate when I get a good job, when I get out of debt, when I can finish my transition. Yes, we all know I've spent 20 grand of my own money to have bottom surgery. My transition's not done. There's more stuff that needs to be done here. I'll be happy when I see society change and not just words in an act. So let's not celebrate just yet. Let's keep working, folks, and keep moving with this. Yeah, me, Jennifer McCreath. What else? Newfoundland Patient Association for Transsexual Health, npath.net. It's been on again, off again project of mine. I think it's back on. The website's there. We as patients need to step up to the plate and advocate for the services that we need. Having politicians talk to politicians is not going to solve our problems. Having doctors talk with other doctors, that's not going to solve it either. We as the patients need to take ownership of our bodies and our health care and project manage our transitions. npath.net, in my opinion, is the best way to go about doing that. I'm going to be revitalizing that brand name. I'm also going to be taking advantage of the fact that it's now Transgender Day of Remembrance next week, or November 20th. Some folks are calling it Transgender Week, as I've alluded to in my past videos. I'm going to be hosting events in 2 Newfoundland cities. Not sure how big they're going to be, but I will be there. I will be putting out press releases. I will be in Gander, Newfoundland on November 19th, St. John's on November 20th, Transgender Day of Remembrance, candlelight vigils. We will commemorate lives lost in the world due to murder and suicides of the trans community. Stay tuned. I'll get more information out there for you as soon as I can. Thank you everyone for watching. JenniferMcCreath.blogspot.ca if you want to read the full press release on this. And I've done radio, I've done television, I've been in the newspaper. I'm going to put links up to all that good stuff too. Thanks for watching, if you're still watching. Jennifer McCreath saying have a good night. Thank you very much.